Okay, so welcome. My name is Dr. Amber Schmidt-Key, and I am trying to give you a bit of a voiceover tour of the Geospatial Information Office hub for COVID-19. Especially now that GEMA has discontinued its daily situation report, understanding the functionality of this website and the tools that it offers is even more important. So we'll start by getting through some of the cool stuff that's here. The way you see the screen will look a little different. You won't see this hospitals or schools tab. That's stuff I'm able to see from being part of the COVID-19 data task force for the state, but we'll try to hit all the things that are publicly available. So, you get some national statistics up here on the top, and then there are icons that take you to different things. And this website is a treasure trove of tons of information on demographics, stuff to learn about your community, even outside of COVID. There's a lot of really interesting information here. The first thing to see is if you scroll down past those icons is another representation of the Department of Public Health dashboard, or what their daily report kind of looks like, but in a different format. So on the right, it takes a little bit of time to draw sometimes, but what you're looking at here there are several tabs where it's the counties of the state, and you can zoom in or out if you choose to. You can click and drag your way around. You can click on a particular county and you'll get some information. Right now, we're on the cases per 100,000 population tab. So this is cumulative data. It is telling you everything from the beginning of the pandemic to now. But you get some information here that you don't necessarily get to see through the Department of Public Health daily report, including demographic data for the cases that have happened so far. So again, it's limited value because this is not recent. This is historic since the beginning of March. So you can see how cases have broken down by age. You can see how they've broken down by gender, and you can also see how they've broken down by race and ethnicity. And this is true for every one of the counties. If you click on deaths per 100,000 population, you'll see some of the same kind of stuff. There's a death rate that's provided for each. Right now we're looking at Upson County. And then you get data on the deaths per age, or deaths by age, excuse me, deaths by gender, by race and ethnicity. And then here's just another way to look at that. If you click on case demographics, it comes up with these really pretty visualizations showing you a histogram. That's the name of this kind of graph, showing you the age distribution of cases by age, by race and ethnicity, and then you've got some pie charts that show you how cases were distributed by sex and the presence of an underlying condition. The same is true for deaths. It's more or less the same formatting, just different data. You can also see cumulative cases that are not adjusted for population. I really don't think this is very valuable because it's always going to look like a population density map, because the more people that are there, the more opportunities the virus has to spread. And we're not really adjusting for population. The same is true for cumulative deaths. So I usually tend to hang out in these spaces, but really one of the most helpful things here are these case and death demographic pieces. On the left-hand side, you can see statewide information for total confirmed cases, number of total hospitalizations. Again, this is cumulative information, and total deaths. They have a graph that shows you cases by date of symptom onset and cumulative case count. You can also click on deaths. That will change the way that, or the data that are provided here. You can see we've had 2 big peaks when it comes to deaths. You can see how hospitalizations have varied over time. And again, it makes sense with our history. And then rolling averages as well. So we'll go back to cases. There's one other thing we want to make sure to point out here, and that is that you can change the information that's shown here on the left through the drop-down menu. So unfortunately, this isn't intuitive. You can't click on, say, Jefferson County, and it will automatically update what's over here on the left. Instead, you have to pick that from the drop-down menu. So we'll go to Jefferson County. There we go. And now the information, first of all, it will zoom into the county of interest on the right-hand side and bring up its pop-up. But the other thing is over on the left, you can see total confirmed cases, total hospitalizations and deaths. You can also see the case curve by date of symptom onset as well as cumulative case count. And then all of these tabs that are over here on the left, including hospitalizations and rolling averages, will also update for that county. So this is, again, a really interesting way to look at this information that we already sort of see through the Department of Public Health website, but in some ways it's packaged a little better here. And this information is updated daily with the Georgia report from the Department of Public Health. There's some information here about the symbology. Periodically, they have to change the color ramp because the cases grow so large that we lose the ability to discern the very biggest counties or the very smallest counties. And so sometimes those color ramps have to adjust. So there's some information about why that's the case. There's data available here to support that dashboard if you ever want to explore that information on your own. The maps of regional hospital capacity, or these hospital capacity dashboards, are also super useful. They are updated roughly twice a day, right around midnight and right around the time of the DPH report that comes out around 3 o'clock. So we'll start, even though it's on the right-hand side, and we tend to move left to right in English-speaking countries, we'll move on to the Georgia Medical Facility Patient Census first. And this is showing us COVID-specific information. Our other dashboard that you're going to see here is for all patients, regardless of their symptoms or needs for hospital use. But this window over here is for COVID-specific information. So on the bottom left, I want to point out two things. We've got total patients in this, right? No, total COVID patients, sorry. On the left tab, you can also click on non-COVID patients so that you can see what normal hospital trends for non-COVID related reasons would look like. And then they have a graph for patients under investigation. This means people who are suspected of having COVID potentially and are waiting for a test result. So we'll go back to total COVID patients. And you can see that our cases have increased, or hospitalizations currently hospitalized have increased and have waned since then. We're still high relative to our pre-Memorial Day surge, or our post-Memorial Day surge rather, but it's declining, and that's good news. On the upper left, you can see sort of the at-a-glance details. Total patients that are hospitalized, how many of those are COVID patients, and we get a percentage for that. How many are non-COVID patients, and how many patients are under investigation. In many ways, it kind of makes sense to lump these two populations together, the COVID-19 patients and those that are under investigation, because from a PPE or containment or contact precautions sort of standpoint, the hospital may be treating those populations the exact same way. So until those test results come back positive or negative, they're still going to treat that person as though they have COVID. So as of today, for example, there's 11.7% of the currently hospitalized people are COVID positive. Another 4.4 are awaiting test results and may be COVID positive. On the right-hand side, we see a map, just like we saw before, but this time, rather than being broken down by a county level, we're seeing a hospital region level. And we're looking at, again, statewide data. You can click on an individual region. Right now I'm looking at Northwest Georgia, Hospital Region A. And they show that 9.4% of the patients that they're hospitalized right now are classified as COVID patients. If you ever want to see what the legend looks like for this, you would click on this icon that's here. It's sort of a shaded color ramp rather than color categories, so it can sometimes be hard to understand the differences, so sometimes it's helpful to have this up here with you. And then, so if you go to, in this color ramp, the darker the color, the more intense the situation. So whereas Hospital Region A has 9.4%, something like Hospital Region H has 24.2% of their patient population being COVID positive. And I think that kind of, and you can get map data for lots of different things. Let me get back to what I was trying to do here. But if you wanted to see what has the history been for a particular hospital region, just like we did before, you would come over here to the drop-down menu and select, say, I used to live in Hospital Region F, so we will look at them. And that should automatically update what's over here on the left-hand side. And so this is where we are now, but this is where we have been. And you can see where we have been for all patients, regardless of COVID positivity or not, and those that have been under investigation. The reason that persons under investigation may be declining may be because we're getting better at testing, and so people aren't waiting quite so long for that test result. Okay, let's back out of this. Go see some of the other really cool stuff that's available on the GIO Hub. Okay, so that was patient census. Let's look at the hospital capacity dashboard. So this one is going to show you not necessarily COVID specific stuff. This is total usage regardless of reason. You get an at a glance kind of look again on the top. This is statewide data, and it shows you how many inpatient beds are in use currently, how many ICU beds are in use currently, emergency department beds, and ventilator use. It should be noted that they don't track pediatric ventilators. So far, that hasn't been a big issue. This is the statewide data map, and what you can see here is that the darker the color, the more intense the usage is. And so for right now, Hospital Region C is having a greater strain. So this is looking at total general inpatient beds. So this is basically all general, sorry, that's redundant. So these are just the run-of-the-mill beds that are in the hospital, not an ICU, not an emergency department bed. But if you're admitted to the hospital and not falling into one of those categories, this is where you would be. And so they're at about 93% of their occupancy, or capacity, sorry, is occupied. Let's close some things here. You can see how inpatient bed usage has varied over time. You'll notice that it tends to drop over the weekends. That's weekend effect. It's a pretty regular pattern and easy to predict. ICU bed usage also sort of sees a weekend effect, although it's not quite as sharp as what you see for general inpatient beds. ER or emergency department beds kind of have a similar trend. And then here's what ventilator usage looks like. And again, this is statewide. Let's say we wanted to choose and again, this map over here, still looking at statewide data. You can click on ICU bed usage rate, but what you'll notice is that doesn't really change anything that's going on over here. For some reason that zooms out really far. And then here's what ventilator usage looks like. But let's say that once again, we wanted to look at a particular region. This time, let's look at region J. So the coastal part of Georgia, you'll notice over here that it did update the information. Here's what it looks like. So this is where we are now. This is how we got here. And this is for ventilator usage. So this graph goes with this number right now. And if you click on this or hover over it, you tend to see the value in case you're ever wondering what that history was. For some of these graphs, it will be a rounded number, but since ventilator usage is pretty low, or it's usually a small number, they don't need to round quite so much. You can see how emergency department bed usage has varied, as well as ICUs and inpatient beds. So lots of information in here, super helpful. Okay, so those are the big things. So if you were like, that's enough, I can't handle anymore, I understand if you need to click off now. But we'll look at some of the other really cool tools that are available here. In the maps for planning, there is so much information here. These are COVID-19 impact reports, which tell you a lot about your community. We're going to choose, I think it's set to Appling County typically to start with. And that's sort of the defaults. And it'll give you information on things like how much of your population is a senior citizen, and how many of them are male versus female. How many beds are available in your county? How do people get their health insurance covered? Some of your at-risk populations. And I should also point out there's a second page to all of these. A lot of people forget that, but there's a lot of information on the second page that has to do with economic factors in terms of poverty level, school enrollment, population without health insurance, all of that kind of stuff. And so again, this exists for each of the counties in Georgia. And so that can be really interesting to kind of poke around your own county just to understand how things work. This is the tool from Georgia Tech that estimates the risk of somebody being positive at a gathering that you might be planning. It's a great resource. It's a little bit harder to navigate than some of the other tools that are on here, but it is there. This is another really interesting tool that looks at nationwide data, but at a county level. And so this way you can see sort of the risks and the hot spots as they exist across the country. There's also some information here for small business vulnerability index in terms of, given the local economic situation, how vulnerable are you to some of the, more severe economic impacts of the pandemic. We have some maps for social distancing and mobility. I tend to like the unicast one more. We'll take a look at that real quick. It's very intuitive color coding, red, yellow, green. Or is it blue? I think it's blue. All right. Come on now. You'll see that most of Georgia is classified as an F. It is blue. Otherwise we have barely passing grades if this were a school. That's mostly kind of because a lot of our population has sort of given up on trying to stop this pandemic. But, it's a really interesting tool, and especially earlier in the pandemic, it was a pretty neat resource. This is another way of looking at it. I tend to find this one easier to look at. This one looks at how cell phones are moving. And so it's de-identified information. They can't tell that, say, Amber Schmidt-Key is in her home, for example. But it's interesting, telling you how far a cell phone has traveled from home, those sorts of things. There's a lot of information here for businesses and unemployment. A lot of the same sort of tools, just now we're looking at it from an economic perspective. One thing that I really thought was really cool when I first saw this is the predominant industry by county. And so, for example, we'll wait for it to draw. And that blurb does have information about how to navigate this. So I'm just gonna barrel through this a little bit, but that's not typical. So let's see, I used to live in Houston County. And there, the predominant industry is public administration. And I would hazard a guess that might be military, because there's a military base there, but I don't know for sure. Peach County is more of like a healthcare kind of thing. And so it's interesting. I had no idea some of these things about some of my neighboring counties. So you might find that interesting too. This is a neat tool that actually one of my followers sent me, and then I sent over to the data task force and they were able to add it. But this is from the University of New Hampshire, and they have looked at things like how the economic crisis has played out at every state. And so there's all sorts of different things in terms of like initial unemployment insurance claims by week, the industries that are most impacted by job loss, things like that. This is another treasure trove of information. I'm not an economist. I have a world of empathy for these folks, and the crisis that they're having to monitor, just as I'm monitoring the public health side of it. Neither one is more important than the other, but I'm going to leave it to somebody else who's an economist to really walk you through some of the stuff here, but it's super interesting. Okay, and come on now. Okay, maps of social media. This is really interesting too. You can see a word cloud for how your county is talking about the pandemic, whether it seems to be optimistic or pessimistic. Little blurb about how stuff works. So anything that's coded, let's get our icon, in green, or our legend, anything in green is considered positive sentiments, anything with red is considered negative. So let's see what they're saying in, I think this is Jones County, yes. So interesting. It's not necessarily talking about, some of the words are about coronavirus and quarantining. Pancakes are really popular there, and mushrooms. There's a lot of food stuff on here. I kind of wish I could go back to Jones County and do some good eating. But this is an example of how is the social media presence in your county seeming to cope with the pandemic. Of course, everybody lives their best life on social media, so just keep that in mind too. Okay, this next section I don't use too much, but it is interesting in terms of how vulnerable is a city to things like disease spread, social vulnerability, and health insurance coverage. So similar sort of map styles in terms of how to find the legend, how to navigate. but I'm not going to spend a lot of time in here today. There are links to neighboring state resources. Say you live along the Georgia-Florida border and you want to know what's going on in Florida. That information is here. And other states too. And then there's some additional information from Johns Hopkins University as well. So this is kind of cool. Walmart has their data here on how there's the store status and things like that. So let's see what this one has to say. I haven't looked at it in a while. But you know, where is grocery delivery available? Let's get over to Georgia. Obviously, there's a lot more Walmarts in the Atlanta metro, but we could click on one, and I'm going to move this. So this is in McDonough, and everything is open there so far. You get a link to their Facebook profile. Sorry, I thought there was more information coming to this, so maybe it's not quite as helpful as I initially kind of thought it was, but that's pretty cool. All right, and so I think that's it. I think if you can, go ahead and hit a feedback survey. I think I would really appreciate knowing what you think of this site, if there are things that we have made confusing, not on purpose, but if there are things that can be made better, I think the state would really appreciate having that information. So, and of course, if I found that thing through, or a follower found that thing through University of New Hampshire. If you want to contribute a link that they should consider adding, this is the place to do that too. So the Geospatial Information Office, they're incredibly smart people. I've been really impressed with my work with them. You know, I think they've built a really robust website here. Okay, I think that does it for today. So thank you so much for watching this video. I hope you found it helpful, and that should probably conclude our recording. Thanks.